It's Nurse Leslie here, the Beauty on Duty. Today I want to talk a little bit about cultural diversity in healthcare. So recently I was reading one of my nursing books, which I love, love, love. It has an entire section dedicated to cultural diversity, and I have learned so much that I wanted to share it with you, and I hope that you find this information useful. So first, I want to say that the information in this video should never be considered the standard or the norm across the board, okay? Everybody's different. People come from different backgrounds. People come from different upbringings, and they share or they have different personal beliefs. So don't just assume that because they are a part of a certain cultural group or race or ethnicity that these things are going to be applicable. They're not going to be applicable to each and every individual. It's important to always learn, keep an open mind, and ask questions, but still at the same time be sensitive. And also, I want to say, leave your prejudices and your preconceived notions at the door. And in fact, you probably just want to get rid of them. They're not professional. They're not going to help you with providing any nursing care. So just leave it alone. It's not going to help you if you go in assuming that a person is going to be a specific way because, they may just prove you wrong. So I want to say, it's important to be aware. The more aware you are, the more you learn, the more knowledge you have, the better your chances are going to be at building a rapport and understanding your patient on a cultural level. So I hope some of these things help. So for instance, you don't want to go into the room and assume that because a person looks a certain way that they are a certain race or ethnicity. A person can, look a certain way and they may actually be biracial, and they may not identify with one half of their family. They may identify with the other. Or they may look like they're Black or African American. They may actually be Cuban or Dominican, so it's important not to assume. If a person is young, don't go in, changing the way you talk and talking slang and stuff. You just make yourself look stupid. And don't assume that it's okay to call everybody by their first name. A lot of people in the older generations, they find it disrespectful if you call them by their first name. So that's important to remember. With a lot of my patients, what I'll do, I'll go in and I'll say, "Hi, I'm Leslie. I'll be your student nurse today. May I check your armband, please?" "Oh, okay. Your name's John Smith. Well, what would you like me to call you?" "Oh, Mr. Smith? Okay, great. Well, Mr. Smith, how are you feeling?" Something like that. It doesn't necessarily have to go that way, but that's just what I do a lot of the time. With American Indians and Asians, a lot of times they will not request pain medication, and that's okay. It's the patient's right to refuse medication, but it sometimes they believe that it's a punishment from the higher power. So don't tell them, "Oh my gosh, that's so ridiculous, what are you talking about?" Just respect their beliefs and don't force them medication. A lot of times with Asians, in particular Chinese, Korean, and Japanese, a lot of times they will prefer a same gender healthcare provider. So, do your best to accommodate them as well as be respectful. With people of Haitian and Arabic descent, a lot of times they're very expressive, they're very emotional, they may speak a bit louder than what we consider normal, but that's okay. That's just the way that they communicate. They're not being hostile, they may not be angry, that's just, the way that they communicate sometimes. Also with Arabic people, a lot of them are Muslim, and something that's very important in the Islamic faith is called Ramadan, and for an entire month they fast from sun up to sundown, so that's important to remember. And when they can eat, or when they will eat, it's important for when you serve them food, don't serve it with your left hand. because they consider the left hand dirty, like it's the toileting hand. That's the hand that you use to take care of your business when you go to the bathroom. Also, no shaking hands with the left hand. A lot of people, not just Arabic people, a lot of people find that disrespectful. With Haitians, as well as Latin Americans, a lot of times they will prefer alternative healing, alternative medicine, folk healing, things like that, and that's perfectly fine. It just makes it that much more important to know what type of herbal remedies and medicines that they may have had before entering the healthcare facility as well as after. Because we don't want any interactions, we don't want any unnecessary problems, so do your full assessment. With Latin Americans, a lot of times they speak very fast. Their primary language a lot of the time is Spanish, and if they don't speak English, you can't just assume that because they have a family member there or you have a contact phone number for a family member that you can just use them as a translator. You put yourself at risk for miscommunication, and you put yourself at risk for HIPAA violations. So it's just better not to even go down that road. Just, get an interpreter that's available through your healthcare facility and do it that way. Follow their protocol. Also, with Latin American as well as African American families, they are very, very family oriented. So if there's 10, 15, 20 people coming to see a patient, that's normal for them. Be respectful, make them feel welcome, make them comfortable. If they need some chairs, get them chairs. Do your best. There may not be 15, 20 chairs available, but do your best. And also with Christians a lot of times believe in faith-based healing. They believe in the power of prayer. They believe in miracles. So it's important, if they are praying, just come back later, give them their privacy, and if they need, if they request like a priest or a minister or a pastor, make sure you have the proper contact phone number so that you can supply them with the things that they need. So I hope these things help. If I come across any more information, I'll be sure to pass it along. If you have any questions, let me know and I'll do my best to answer. And I'd be happy to get any comments and rate this video and subscribe to my channel. And I will see you on the next video. Bye bye.